So over the past 49 videos, we've discussed all different treatment options, what can be done, how, what, when, why, where. What do I do? So because I work in a tertiary hospital that is teaching, most of our patients end up getting referred to us rather than come to us. And that means they will have been seen by a lot of primary care physicians who don't really understand pain, but they know how to give pills. If they don't get better, they'll come into our hospital and see a subspecialist like neurology, neurosurgery. They might go to ortho or rheumatology. Again, subspecialists who really understand how to treat conditions, but not the person. So they do wonderful work, but the kind of work that remains then is to treat the person. How do I treat the person? The first thing is always to see what they want and what they're willing to do. Everybody that comes with pain wants to be relieved of pain. Do they understand they're creating that behavior? They probably don't. If they're having pain, they probably want relief. So the procedures we do can do that. What procedures do we do? If they're terrified of needles, then we'll talk about shockwave therapy, laser therapy, ultrasound, IFT, all those different devices that bring the pain down temporarily. And then from there, when the pain is down, we start seeing what is making that pain, because then we make a customized exercise program for them. If a person improves with a customized exercise program, that's great. Very likely they're just having ergonomic stresses from the kind of life they have to live. If their pain is not going away, or the pain is now matching myofascial trigger points or the distribution of a peripheral nerve, we can do things like prolotherapy. If it's a nerve, we can inject along the nerve to get it freed up. If those don't work, we still have further options, because many times what can drive up pain will be stress. And I've been trained in Europe for neural therapy, which addresses the psychosomatic nervous system by injecting autonomic ganglia. Now in India, you won't find many other practitioners who actually know or do this to this capacity, but we find that all these different things work. When the anxiety and pain are controlled, the next thing is to get a person to identify what behavior is making their pain. And that's always a challenge, because many times it's something they do that they take for granted, they think is perfectly normal, that's actually a problem. And that could be the food they eat, the way they use social media and technology, the habits they engage in when they're not doing things to sustain themselves, all of that. And this is where a typical back pain consultation or neck pain consultation actually requires 6 months of comprehensive rehabilitation. Most people don't understand that. So they get some pain relief, they run away, they come back with pain because they don't know what more is to be done. But this is how we work, and this is what I do.